So today I want to talk about facelifting surgery. Facial aging is a phenomenon that typically affects people from their 40s upwards. There tends to be no upper limit, and in fact I've operated on patients in their 70s and 80s with great success. It's a problem that both men and women can experience, although to give you an idea, 80 to 85% of our facelift patients are ladies. Facial aging manifests itself in a number of different ways. As the skin loses elasticity and as the facial volumes change, either becoming fuller with weight gain or becoming slender after exercise, the face can fall. This can be seen in the cheeks where the cheekbones become empty. It can be seen around the corners of the mouth where heavy lines develop and the mouth turns down. It can be seen below the mouth in an area we describe as marionette lines. It can also be seen across the jawline where the tissues of the face fall across this boundary, creating heaviness, which we call jowls. Overall, all of these effects tend to make the face look heavier, sadder, tireder, and a little more aged. Furthermore, the neck also falls. This fall creates loss of jawline definition and can also be accompanied by stringy bands or lines. This is part of the facial aging process also. Should you have experienced any of these signs of facial aging, then a facelift consultation may be for you. At this consultation, we will discuss the elements of your facial aging. They are not always the same in everybody. Different people can exhibit different elements in different orders. We will also discuss what it is that you see in the mirror and what it is that you would like to achieve. Facelift surgery in the vast majority of cases is performed under general anaesthetic, and therefore we will discuss your fitness for such an anaesthetic, and we will also discuss any medication that you take that would either interfere with surgery or healing or your fitness to have surgery. We will also discuss any allergies and also your social and work life. Recovery from facelift surgery can be a relatively prolonged experience, and it's important to make time in most people's busy lives to accommodate the surgery and recovery that may well be necessary. Every patient gets a second consultation to further discuss what we had talked about. We will also discuss at this consultation the follow-up process. We will take some photos and we will give you some very specific information talking about the benefits, risks, limitations, and recovery following facelift surgery. Should you decide to go ahead, then you will be visited by myself and an anaesthetist on the morning of surgery. We will have one last opportunity to discuss any concerns that you have. The operation itself lasts between 2 to 3 hours, depending on exactly what technique used. We often can combine facelift surgery with other rejuvenation techniques, such as eyelids or surgery elsewhere on the body, should that be something you require. You will be brought back to your room after your general anaesthetic, feeling a little groggy. Most people wake up fully within an hour. Myself and your anaesthetist will come and see you following your surgery and discuss how it went. You'll be wearing a relatively bulky, fairly tight bandage in this period. It's uncomfortable, but is extremely important in keeping everything in place. For most people, they describe the bandage as the most unpleasant part of the surgery. Should all be doing well, you will be reviewed again in the morning when we will remove that bulky bandage. We will encourage you to get in the shower to wash your hair, which allows you to have confidence in washing your hair when you get home. Most patients are sent home the morning after surgery. You will be given post-operative instructions and details and an elasticated bandage which you can put on and take off while eating or showering. Our advice is you wear this bandage for 22 hours a day if possible. Your first review will be at 1 week. Should you have any concerns before this time, you will be given a comprehensive set of post-operative instructions and contact details, which you're welcome to use at any time. At 1 week, you will look swollen and bruised. Your scars will be noticeable. you will be uneven, and you will look fairly dreadful. This is entirely normal. We try and warn every patient about this, but it often comes as a shock. At this appointment, we will remove some stitches from your hairline and also a row of stitches under the chin. These are not holding a cut together per se, but they are holding the skin and the thin tissue of the neck in tight association, which promotes early healing, minimizes swelling, and gives a better early result. If there are any concerns regarding infection, which although rare is not unheard of, these often show themselves at this meeting. Infection usually requires simple tablet antibiotics to settle, but it's something to bear in mind. Our advice at 1 week is to go home and take it extremely easy for a second week. You will be able to do light activity, and if you work from home, you'll be able to sit at a computer, but due to the way you look, you will be unlikely to want to go to an office environment. At the end of your second week, if all is going well, then we will advise you to start gentle activity. You can go out to the shops or walk the dog or pick up the children from school, but you will still not look your best. Typically, recovery from facelift surgery, where you can start to go back to normal activity, occurs between 2 and 4 weeks following your operation. By 4 weeks, the majority of patients look presentable. There may still be some subtle signs that you had surgery a month ago, including unevenness, obvious scars, and swelling. The bruising should have mostly dissipated by now, but there will be signs of surgery should you look carefully. For most patients, going back to the office is conceivable at 3 to 4 weeks, but for every patient who's a little bit fast in their recovery, there's one who's a little bit slow. This is normal. In the early phases, you will look not presentable, and so please accept this. People have busy lives and are desperate to get back to them, but there is no rushing the recovery from this type of operation, especially when the signs are so public and on show, being on your face. Infections, although rare, sometimes need antibiotics, but can very occasionally need additional treatment. Scar, swelling, unevenness, and asymmetry are all common. Asymmetric patients before surgery will be asymmetric after. Facelift surgery will not correct fundamental asymmetry, which almost all of us have. Some patients remain uneven even after 4 weeks. Again, massage and time will improve this for us, but patience and natural healing is by far the best way to approach this in the early phases. At 4 weeks, the tissues tend to look quite tight and quite shiny. From 4 weeks to 12 weeks, tissues tend to relax. This is good as it offers a much more natural result, but it also allows a little bit of relaxation of the cheeks, but primarily of the neck. Don't panic. This is not your old neck returning, but it is a subtle relaxation which is entirely normal. Rest assured, during facelift surgery, we pull the tissues as tight as we possibly can, but inevitable relaxation will happen. Do not expect to see your final result for 6 months at least. This is the time it takes for scar tissue to soften, for natural contours to return, and for your face to start to move and behave like it did before surgery. Scars will fade, but they will never be invisible. The hardest one to hide is the one directly behind the ear, which your hairdresser will see. If you are a man with little hair, then of course the scars are noticeably more obvious, and this is something that will be discussed at your pre-op appointment. Should you have any questions or concerns about your facelift result, then we are available. You will be reviewed regularly to discuss how things are going and what we can expect. Mediterranean or African skin tends to show lumpy, hypertrophic, or rarely keloid scars. These are unusual but need to be managed. Swelling and eye bags can be exacerbated by facelift surgery. Please bear this in mind. We can manage these with massage, time, and occasionally steroids. But again, surgery on the face results in swelling and unevenness, which can take some time to settle. Overall, facelift surgery gives excellent rejuvenating results when seen from 2 to 3 feet away or in a room amongst friends. If you look at the result in microscopic detail, which our phones and tablets these days allow us to do, then there will be subtle signs and imperfections of surgery. This is not the scale at which facelift surgery should be appreciated. Facelift surgery is all about how good you look to other people around you in the mirror and how confident you feel. Should you have any other questions or concerns regarding facelift surgery, please get in touch with us here at adamgoodwinsurgery.com. If you have your facelift surgery coming up or you've recently had facelift surgery, then please refer back to this video, which can be a useful covering of the details, facts, and elements that you may wish to know during your recovery.